Lecture 2: Immunotherapy and CAR T cells. Title: Harnessing Immunity CAR T cells and the future of hematologic cancers. Historical contexts. Leukemia and lymphoma treatments. Historical relies on chemotherapy and radiations with high toxicity and variable success. Allogenic bone marrow transplants 1960s leverages immune effects but carried graft versus host risks. The 1980s discovery of T-cell biology and monoclonal antibodies set the stage for immunotherapy. Rituximab 1979 target CD20 in B-cell lymphomas, proving immune-based therapies potential. Current advancements. Chimeric antigen receptor CAR T-cell therapy is a breakthrough. Approved CAR Ts like Kymriah and Yescarta target CD20 in B-cell leukemias and lymphomas, achieving remission rates of between 70-90% in relapsed refractory cases. The process: extract patients' T-cell, engineering them to express CARs and refuse bispecific antibodies, e.g. blinatumomab, and next-gen CARs targets multiple antigens, e.g. CD19, CD22 address relapse due to the antigen loss. Tries explore CAR T for multiple myeloma, e.g. BCMA target therapies, and even solid tumors. Challenges and future directions. Toxicity like cytokine release syndrome, CRS, and neurotoxicity require careful management. Manufacturing is low cost between 4,000 hundreds and 5,000 hundreds per patient. Relapse occurs in 30 to 50% of cases, promoting research into armored CARs with innocent persistence. Off-the-shelf allogeneic CAR T using donor of derived cells aim to reduce costs and place comparing CAR T with checkpoint inhibitors or epigenetic modifiers is the tries to post efficiently. Takeaway: CAR T therapy advanced cancer care, but scaling and safety remains hurdles.